Hello everyone, this is Dr. Shruti, consultant fertility specialist and cosmetic gynecologist working at Kanighat and Mangalore. So today here I am to discuss about vaginal rejuvenation. Vaginal rejuvenation is something which any part of the body needs rejuvenation, be it be mental, face, vaginal area, many more. So in these vaginal rejuvenation, what we usually tell is those tissues needs to be getting rejuvenated. So coming to the vaginal part of it, as all of you know that female body undergoes a lot of changes as the aging process is happening. It is not only because of the pregnancy and childbirth, but also because of the aging process and the hormonal related changes happening in her body. So hormonal changes leads to a lot of distress to the females, not only the vaginal part but throughout the body. Whereas in particular to the vaginal area, what happens is the blood supply to the vagina gets a little hampered as the aging process starts. So from the pregnancy and childbirth, there is a lot of babies coming out, or during the lot of pressure because of the pregnancy. Vagina is the one thing which is getting a lot of damage, you can call it. So the blood supply and the nerve supply gets hampered to a great extent. Following which, as she ages, the hormone called estrogen also reduces in the body, which causes a lot of dryness and itching and a lot of burning sensation as the age progresses in the vaginal area. So that's when vaginal rejuvenation comes into picture. So not only in the older age group, but yes, definitely in the mid age also these things can happen. So after delivery, anytime you are having these symptoms of sexual dryness, burning sensation, irritation, or you don't have interest in having intercourse, all these things calls for a vaginal rejuvenation. So coming to the treatment options, what is available is the laser vaginal rejuvenation and the PRP vaginal rejuvenation. So I'll start with the PRP vaginal rejuvenation. As you all know, PRP is platelet-rich plasma. It's coming up, to a lot of extents in, in different parts of the body where we can use. So it basically, how we prepare a PRP is we draw the patient's own blood and centrifuge it and prepare a platelet-rich plasma out of it after a process, and that platelet-rich plasma is injected into the vaginal canal at different areas, which we are basically giving the growth factors to that area, which helps in rejuvenation of that part of the area. So it is comparatively safe because as we are using the patient's own blood or any irritation causing there, so it's one of the safest options. So coming to the actual process, so this is the vaginal canal which is there. So we inject PRP at different levels, at different intervals, which helps in the rejuvenation. It helps in the rejuvenation of that particular part. Coming to the treatment as such, after injecting, we do recommend 2 to 3 sessions at minimum at intervals of 3 to 4 weeks of each session. So this helps in we need to give time for the PRP to act and neovascularization and collagen remodeling to happen at that particular area. So at 3 to 4 weeks gap, we call you for another session. So after 3 sessions, we see how much development in your symptoms, and based on that, we do recommend, if required, 3rd and 4th and 5th sessions. So this PRP works like beautifully for all these complaints, be it be premenopausal or be it be post or perimenopausal age group also. So coming to the next treatment option, that is the laser vaginal rejuvenation. Laser vaginal rejuvenation also, the concept of it is at a regular intervals, we have a probe something like this in a longer way and a little more bigger. We put it into your vaginal canal and shoot at regular intervals. What it causes is a minor trauma to your vaginal canal, where it stimulates and lot of growth factors comes into that place to rejuvenate that minor trauma. In that way, it helps in neovascularization and definitely collagen synthesis also. So both of this helps in when the blood supply to that area increases, so that helps in the lubrication or the liveliness to that tissue, so which helps in giving you lubrication, which helps in dryness and the reduction in burning sensation also. So these sessions are also done at intervals, which we recommend is 3 minimum sessions, and after that, depending on your symptoms, you can add on sessions. And these sessions last you for, depending on patient to patient, 6 weeks and 6 months, 8 months, 12 months, and after that you can have a touch-up sessions if required only. So laser vaginal rejuvenation is one of the beautifully treated treatment option for your burning sensation. The benefits of both of these treatments are you don't need any admission in the hospital, you don't need any anesthesia required. It is just, you will just need a couple of hours. Laser needs a little 45 minutes lesser, because PRP you need 45 minutes to prepare the sample and then inject. Laser doesn't need that, but laser or PRP both, we put a cream, mild numbing cream at the vaginal canal, and after the effects of it, we start the procedure. So you can get up and go immediately after the procedure. You don't need a bystander along with you for both of these procedures. Okay, so this is roughly about laser vaginal rejuvenation plus PRP vaginal rejuvenation. So if you have any queries, feel free to comment in the comment section below, or you can call us directly. Thank you very much.